Hello everyone. Today, we are going to talk about the clinical features of heart diseases. There are some common symptoms that occur following heart diseases. They are chest pain, dyspnea or dizziness, palpitations, syncope, fatigue, and peripheral edema. First, let's talk about chest pain. Chest pain is one of the commonest clinical symptoms that we hear when it comes to heart diseases. Chest pain has many causes. According to the cause, it can be divided into two main parts: causes of central chest pain and peripheral chest pain. Now let's talk a bit about the causes of central chest pain. Causes of central chest pain can further be divided into cardiac causes and non-cardiac causes. Cardiac causes of central chest pain are ischemic heart disease, which includes myocardial infarction and angina, coronary artery spasm, pericarditis or myocarditis, mitral valve prolapse, aortic aneurysm, or dissection. Aortic aneurysm is dilation of a part of the aorta. Aortic dissection is bleeding into the aorta wall due to a tear in the inner wall of the aorta. Similarly, non-cardiac causes of central chest pain are pulmonary embolism, esophageal disease which includes gastroesophageal reflux and even gastritis, mediastinitis, costochondritis, and trauma. Now let's come to causes of peripheral chest pain. Causes of peripheral chest pain can be further divided into pulmonary and non-pulmonary causes. Pulmonary causes of peripheral chest pain are infarction, pneumonia, pneumothorax, lung cancer, and cancers of pleura such as mesothelioma. Non-pulmonary causes can be herpes zoster infection and trauma to the chest. Herpes zoster is a disease that is due to secondary infection due to the chickenpox virus. And now, let's have a look at characteristic types of central chest pains and their features, as this is the commonest type that you will encounter in your clinical training. A retrosternal, heavy, gripping type of chest pain which is usually radiating to the left arm or jaw that is provoked by exertion and eased with rest or nitrates is commonly caused by angina. A retrosternal, heavy, gripping type of chest pain that radiates to the left arm or jaw that is present even at rest, could be due to acute coronary syndrome. Acute coronary syndrome includes myocardial infarction and unstable angina. A severe type of central chest pain that is tearing in type and that radiates to the back, often suggestive of aortic dissection. A sharp, central chest pain that is worsening with movements or respiration and that is relieved with sitting forwards, highly suggestive of pericarditis. So, we have talked about chest pain and its causes. Hope you got a clear idea about chest pain. And now, let's move on to dyspnea. When the breathing is difficult, or the individual has to do extra work for breathing, we call it dyspnea. The most common cardiac cause of dyspnea is left ventricular failure. Left ventricular failure causes pulmonary interstitial and alveolar edema. This makes the lungs stiff and it will eventually lead to increased respiratory effort. There are several types of dyspnea. These are tachypnoea, orthopnoea, paroxysmal nocturnal dyspnea, and Cheyene-Stokes breathing pattern. Now, let's talk about these types of dyspnea. Tachypnoea is simply increased respiratory rate due to stimulation of pulmonary stretch receptors. Orthopnoea refers to breathlessness on lying down position. Blood is redistributed from the legs to the torso, leading to an increase in central and pulmonary blood volume. In orthopnoea, the patient uses an increasing number of pillows to sleep. Paroxysmal nocturnal dyspnea occurs when a person is woken from sleep, fighting for breath. It is caused by the same mechanisms as orthopnoea. However, as sensory awareness is reduced in sleep, the pulmonary edema can get quite severe before the patient is awoken. Cheyene-Stokes breathing pattern is seen as hyperventilation with alternating episodes of apnea. This is mainly seen in severe heart failure. Palpitations are recognized as increased awareness of the normal heartbeat or the sensation of slow, rapid, or irregular heart rhythms. Palpitations have many causes. The most common cause of palpitations is arrhythmias. Arrhythmias could be due to premature beats or ectopics, paroxysmal tachycardias, bradycardias, and so on. I'm sure many of you have encountered syncope at least once in your life. Syncope is a transient loss of consciousness due to inadequate blood flow. To be simply put, a fainting attack. The cardiovascular causes of syncope can be divided into vascular causes, obstructive causes, and arrhythmias. Vascular causes are vasovagal attack, postural hypotension, postprandial hypotension, micturition syncope, and carotid sinus syncope. Vasovagal attack is the most common cause of syncope and it is experienced caused by a drop of systolic blood pressure, 20 or more, on standing from a sitting, or a lying down position. Postprandial hypotension is a drop in systolic blood pressure of 20 or more, within 2 hours of eating. Micturition syncope is fainting while passing urine. Carotid sinus syndrome occurs when there is an exaggerated vagal response to carotid sinus stimulation, provoked by wearing a tight collar, looking upwards, or turning the head. Obstructive causes of syncope are aortic stenosis, hypertrophic cardiomyopathy, pulmonary stenosis, tetralogy of Fallot, pulmonary hypertension or pulmonary embolism, atrial thrombus, and defective prosthetic valves. Arrhythmias causing syncope are rapid tachycardias, profound bradycardias, significant pauses, artificial pacemaker failure, and so on. Fatigue may be a symptom of inadequate systemic perfusion in heart failure. Other contributing factors may include poor sleep, side effects of medication, particularly beta blockers, electrolyte imbalances due to diuretic therapy, or a systemic manifestation of infection like endocarditis. Heart failure results in salt and water retention due to renal underperfusion and consequent activation of the renin-angiotensin-aldosterone system will lead to peripheral edema. This can be seen as ascites, or fluid in the abdomen, and ankle edema.
Hope you enjoyed the video and don't forget to like, comment and subscribe.